Hello guys, this is Paul and you are watching Paul Medico. Today in this video, I am going to talk about some complications and treatment about the alcoholism. Nowadays, taking of alcohol as a drink and its hazards and complications are of great concern. So in this video, let's talk about what is acute and chronic alcoholism and what are the complications and how those cases are managed. So at first, what is alcohol? Alcohol is a beverage that we consume and it is formed mainly by fermentation by the yeast, and after that distillation for the concentration of the alcohol. Now absolute alcohol is 99.5% ethyl alcohol. Along with that, if water and other additives are added and the fortified, then the different forms of alcohols are produced, and those different forms are used in the industrial basis, in the medical basis, as a spirit or rectified spirit or proof spirit or alcoholic beverages for the consumption by us. So at first, what is when alcohol goes inside our body, what happens to that alcohol? At first, the alcohol is absorbed from a little amount is absorbed from the stomach, and maximum amount is absorbed from the upper part of the intestine. In the stomach or in the intestine, the absorption depends upon some factors. The absorption is mainly more at 20 to 30% of optimum concentration. The absorption decreases beyond this concentration because below the 20% of the concentration, the emptying of the stomach increases, and above the 30% of the concentration, there will be pylospasm and increased mucus secretion. And this absorption increases also in empty when the alcohol is taken in empty stomach with lemonade and soda water, or the neat alcohol is taken. Alcohol absorption also decreases when it is taken with the fatty food or the vitamins and the nutrients. When the emptying of the stomach is faster, then also the alcohol consumption increases. Now comes what happens to this alcohol when it goes inside the body. So after absorption, it goes into the liver for its metabolism. In the liver, there are two enzymes, that is the alcohol dehydrogenase and aldehyde dehydrogenase. By the action of these two enzymes, this alcohol that is the ethyl alcohol will go in the form of acetic acid, and after that it is excreted. But some amount is also stored in the cholesterol and fat. Now this alcohol, to some extent, this approximately 10% is excreted unchanged in the urine, in the lung, through the exhaled air, in the sweat. So in the exhaled air we find the smell of the alcohol, and this is the basis of the test of Weidmark test to find out the blood alcohol concentration by applying two formula, that is capital A is equal to PRC, and that is the capital A is the blood alcohol concentration, equal to the P, that is the weight of the body, into R, a constant factor which is 0.5 for female, 0.6 for male, and C, that is the concentration of the alcohol per kg of the body weight, milligram of the alcohol per kg of the body weight. And then the alcohol concentration in the urine is measured by the formula small a equal to 3/4 into PRQ. Here small a is equal to the alcohol in the urine, and the Q is the concentration of the alcohol per kg of the body weight. Now comes, and the remaining factors the same. Okay, now comes the alcohol is also excreted in the sweat, but the amount is very less. Now we have to know what are the effects of alcohol when it is taken. When the alcohol is taken at a percentage of less than 50 milligram percent, then the alcohol concentration, then the person will be dry and decent. When the alcohol concentration is 50 to 100%, then the person will be light and devilish. When the alcohol concentration goes above 100, that is 100 to 200%, the person become delinquent and devilious. And when the alcohol concentration goes from 200 to 300%, the person is dizzy. When 300 to 400%, the McEwen sign become positive and the person is dazed. When it is 400 or above, then the person is dead drunk. Now, what are the clinical manifestations of acute alcoholism? Now, what are the clinical manifestations? There are 3 stages of clinical manifestations in the acute alcoholism. Those 3 stages are: at first, there will be stage of excitement, as the higher centers are totally inhibited. As the higher centers are totally inhibited by the alcohol, so there will be increased self-confidence, decreased self-control. The person will be excited, angry, quarrelsome, rude. And when this person also have some increased sexual desire. But the main problem is the person will have tachycardia, palpitation, sweating, and the pupil will be dilated. The person will have blurred vision and slurred speech, and he or she will lose his memory, that is a state of amnesia will also present. In the next stage, there will be the state of intoxication. That is the moderate intoxication or incoordination, the state of incoordination also. Now, in the first stage, that is the state of excitement happens approximately 0.5% to 1% of the 0.05% to 0.1% of the alcohol concentration. But when the stage of incoordination occurs, it occurs 0.1 to 0.2% of the alcohol concentration. In the stage of incoordination, the person will show amnesia. The person will lose neuromuscular coordination. So, there will be tremor. Along with that, the person will have slurred speech, blurred vision, McEwen sign positive. No, not in this stage, in the next stage. So, there will be positional nystagmus, lateral or horizontal nystagmus. Okay, and there will be diplopia or the double vision, and the pupils are dilated. In the next stage, that is in the stage of stupor or the stage of coma, when the alcohol concentration goes beyond the 3.3% to 0.5%. Then the pupil will be constricted, and here the Ewing sign become positive. Because the Ewing sign, how it is positive? Because when a person is given a painful stimulus, the pupil will be dilated, but further after that the pupil will be constricted again, and at this stage the face will be pale, and the skin will be cold and clammy. There is marked cyanosis. And in this stage, if the person is kept in the cold, the person may die, as the body temperature falls to a severe extent. Okay, so now we have to know how we can avoid this high blood alcohol concentration. It is very simple. What we have to do, we should not intake the neat or the alcohol with the soda or lemonade. We should avoid to take the alcohol in the empty stomach, and before taking the alcohol we should take some fatty food like butter, cheese or or milk, because that will delay the emptying of the stomach. And along with the along with this food, we should take some new nutrients like vitamin B1, vitamin B1, B6 and we should walk after taking the alcohol, because that will increase the metabolism in our body. Now, how a case of the acute alcohol intoxication is treated? Nothing is done. Actually, nothing is done in this case. Only the person is laid to sleep, and if there is something clinically present, then that is symptomatically managed, because when the person is in sleeping stage, all the effects or the clinical manifestations are passed away along with the metabolism of the alcohol. But for the management, we can do a stomach wash with lukewarm water and sodicarb within the 3 hours of the alcohol intake. MSC is not induced as the person is in unconscious state or in the coma. Then the aspiration may occur. In the stomach, if the person is in excited state, then if the person is in excited state, then paraldehyde is given. After the stomach wash, in that person, the approximately 50 ml of paraffin, liquid paraffin is kept in the stomach. This liquid paraffin acts as a demulcent. Okay, so after giving the paraldehyde, we may give the nicotinamide. In case of acute alcoholism in chronic alcoholics, at first the glucose injection, at first the dextrose injection is given along with insulin. After that, vitamins are given, because there is a pellagra like signs and symptoms which are managed by giving the vitamin B complex. But before that, we have to give the glucose, and there is also antibiotic therapy and some symptomatic managements. Now comes what is the chronic alcoholism and its management. In the chronic alcoholism, we have to know who is a chronic alcoholic. A person is chronic alcoholic when he or she cannot stop the chronic taking alcohol, and that chronically taking of alcohol will have caused some damage to his body and mind, and the person is socially, mentally, psychologically and physically dependent on the alcohol, and cause some problems in his or her life. Now, what are the different types of chronic alcoholism? It may be alpha, beta, gamma, delta and epsilon. In this order, the psychological and the physical dependence on the chronic alcoholism increases. In the delta, that is the French alcoholism, that is the French form, in this stage the physical dependence typically occurs. And in the epsilon form, the person the person drinks the alcohol up to the death. So drinks to death. There are 3 other forms, that is the reactive, the essential and the reactive form. In the reactive form, the person intakes alcohol for his physical and mental stress. In the essential form, the person takes the alcohol because of his or her genetic basis, and in the symptomatic form, the person takes the alcohol due to his or her some mental or psychological problems. And what are the clinical manifestations? In the chronic alcoholism, the main clinical manifestation is the person cannot stop taking the alcohol. So, what are the manifestations when he or she takes the alcohol? The person will have nausea, vomiting, severe abdominal pain, loss of blood vision, slurred speech, blood vision. In the chronic alcoholism, the person mainly cannot stop taking the alcohol. So what happens? At first, there will be nausea, vomiting, abdominal pain. In the primary stages of chronic alcoholism, there will be nausea, vomiting, abdominal pain. And when the disease progresses, there occurs the liver damage. Liver is the main source of protein in our of the plasma proteins, that is albumin. So mainly there will be hypoproteinemia, mainly hypoalbuminemia. So there will be decreased oncotic pressure. So there will be generalized edema, anasarca. The person will have sweating. The person's breath will smell like have smell of alcohol. And one more thing, that is the person will develop cirrhosis of the liver. There will be muscle dystrophy, muscle weakness, cramp in the calf muscles also. So how these clinical manifestations is treated? At first, the main treatment of the chronic alcoholism is the intention to leave the alcohol, and this is mainly the sincere desire, sincere interest of the patient is the main thing. Along with that, the family and the doctors can help him psychologically and some mentally. But what are the medical treatment that we can do? We can give paraldehyde to decrease the excitement. Along with that, chlorpromazine, chlordiazepoxide, and phenobarbital. And sometimes there is antabuse disulfiram is also given. Disulfiram do some severe reactions, because disulfiram do not allow the metabolism of the alcohol and stop the metabolism of the alcohol in the stage of acetaldehyde. And when the aldehyde increases in our body, there are some manifestations like tachycardia, palpitation, sweating, tremor, flushing of the face, and these manifestations mainly make a fear in the mind of the patient that when the patient takes the drug, he or she will by himself or herself will avoid to take the alcohol, because there is a fear of those severe problems. We can also use Tamposil for these manifestations, and we can also use the Tamposil for this act also. Along with that, there is use of naltrexone, which is an antagonist of the narcotics mainly, and conditioned reflex. Conditioned reflex is nothing but a drug, and along with alcohol, a beverage bottle is given to the patient, and the patient by the sight of those combination will the fear will come in the mind of the patient, and the patient will stop taking the alcohol. And approximately 5 to 6 1 or 2 weeks of treatment, or 5 to 6 days initial treatment, the person can leave the alcohol within few months. Now there is a term called alcohol anonymous. What is this? When a person left alcohol, so basically this alcoholic anonymous is, what is Alcoholic Anonymous? Now Alcoholic Anonymous is mainly a association where this association is mainly found by those persons who left alcohol. Okay, and in this association, if you want to join, then the patient should have the desire that he want to leave alcohol. If the patient has desire to leave alcohol, then and then only he can join, because here the patient is motivated that if those persons who have left alcohol, then he or she can also leave the alcohol. And after that comes some, after that let us know about some complications of this alcohol intake. Now, what are the complications? If a person is intoxicated with the alcohol, he or she may not know, but he or she may do some crime. But if this and along with this there is related IPC, that is the 84, 85 and 86. If someone do the crime and the alcohol in the alcoholic intoxicated state, but he or she is not voluntarily intoxicated, then according to the 84 IPC, the person is not punishable who has done the crime, because he is intoxicated by some other. But according to the IPC 86, if the person is have voluntarily intoxicated himself or herself and then do some crime, then he or she will be punishable. According to the 510 IPC, a person is punishable for doing some So let us know about 185 IPC. This is mainly related to the drink and drive case. If the blood alcohol concentration during the driving is 60% or 30 to 60%, then the person is punishable, and he or she will be punished up to 6 months for the first crime, along with 2000 rupees, along with 1000 rupees fine, and within the 3 years of the first crime, if he or she done the second crime, then it will be 1 year of punishment, or sorry, it will be 2 years of punishment along with 3000 rupees of fine. In case of the if the blood alcohol level is 100%, then for the first punishment it will be 1 year of imprisonment along with 2000 rupees fine, and for the second punishment within 3 years it will be 2 years of imprisonment along with 3000 rupees fine. For 150% of the blood alcohol concentration, for the first crime the punishment will be for 1 year of for 2 years of imprisonment along with 5000 rupees fine, and for next crime it will be 4 years of imprisonment along with 10,000 rupees fine. Now comes what are the complications that mainly that happens when the alcohol is taken. The person may aspirate, the aspiration pneumonia, not aspiration, that is aspiration may occur during the vomiting. There may be Mallory Weiss tear, as there is a severe vomiting, there may be Mallory Weiss tear. There is Marchia-Fava-Bignami syndrome. Now, what is Mallory Weiss tear? It is longitudinal tear in the stomach and esophageal junction, which will cause hemoptysis, that is a blood vomiting. There is Wernicke's encephalopathy due to bleeding in the different parts of the brain. These nystagmus, that is that eye related manifestations occurs. In the Marchia-Fava-Bignami syndrome, there is one thing, that is the demyelination of the corpus callosum, and it will lead to some manifestations like dementia, delirium, Okay. So this is the thing that and all these things comprises of the acute and chronic alcoholism. So if you like this video, give this video a great huge thumbs up, and if you don't subscribe my channel, so please subscribe my channel and hit the bell icon so that you can get notification of the next video as soon as it goes live. And please comment in the video and tell me what I missed. I know that I have left a lot of things about the acute and chronic alcoholism, but I know this video will be helpful not only for the medicals but also for the non-medicals, how to how to leave alcohol himself or herself if anybody want. So I am bye.